And the early months of the relationship is an opportunity to respond quickly and kindly to baby's needs. And in the time when the baby's crying and overwhelmed, mom's responding to by comforting and helping baby to feel safe, build networks in baby's brain that's rapidly growing. A secure attachment forms between mom and baby.
Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists. On this podcast, we bring on experts who can provide insights to help life-affirming medical professionals in their career and in their practice. I'm Miriam Diallo, I'm AAPLOG's Communications Manager, and I'm excited to be hosting today's episode with a special guest, Betsy Morton, an AAPLOG board member and certified nurse-midwife, whom you might remember from early in our first season, if you were listening that long ago, when she came on to discuss some challenges faced by pro-life midwives. Betsy has been on the board of AAPLOG as head of the midwifery subsection since 2019. She currently serves as the nurse supervisor for the Erlanger Nurse Family Partnership, which is a community health program that serves low-income first-time moms by partnering them with a nurse for regular support from pregnancy to their child's second birthday. She also volunteers with LifeSpring Community Health and Midwives in Support of Life, which is a subsection of the American College of Nurse Midwives. Now, today with Betsy, we'll be discussing an interesting topic that's relevant to anyone caring for moms and their babies, and that's attachment parenting. So, Betsy, thank you so much for joining us today.
Miriam, thank you so much for having me. I'm so excited to talk about attachment and to clarify a little bit about some ways that moms and babies can really grow together.
Absolutely. Yeah, I'm excited to discuss that because I know there's a lot of, when it comes to parenting philosophies and things like that, there's a lot of different terms being thrown around. And I can see how a lot of patients and maybe even medical professionals can be a little bit confused as to what's what. And so, yeah, I'm excited to get some clarity on all of those things. So, but first, can you tell us a little bit about yourself and how the philosophy of attachment parenting or just the concept of attachment plays into the work that you do?
Oh, absolutely. So I read a quote back in the beginning of the time I was working with Nurse Family Partnership by an author that I really appreciate. And he said, every baby is born looking for someone to be looking for them. And this quote really resonated with me as I started working at Nurse Family Partnership because attachment is one of our foundational theories. And everyone is looking to be seen, soothed, safe, and secure. Those are the ideas that come from an author, Kurt Thompson, who has really impacted my life and my thoughts about attachment because he writes a lot about the importance of a secure attachment for babies starting from the beginning. From the delivery room, when a baby is overwhelmed with a cold, loud, bright room, they can immediately feel safe if they're placed skin to skin with mom. And they can hear that familiar heartbeat and her voice and her gentle touch. And this golden hour is the beginning of a relationship that will grow as baby and mom grow. And the early months of the relationship is an opportunity to respond quickly and kindly to baby's needs. And in the time when the baby's crying and overwhelmed, mom's responding by comforting and helping baby to feel safe, build networks in baby's brain that's rapidly growing. A secure attachment forms between mom and baby as mom, baby, and dad as they attune to baby's cues and states. And as baby grows, they set boundaries and loving guidance to help baby feel safe and begin to explore the world. There's something called serve and return that is mom and baby interacting. And that can be, through things like reading to baby, singing to baby, interactive play. And this scaffolds their brain, the baby's brain, which is exploding with connections during these early first 1,000 days. So attachment itself and attunement to baby's needs is really the foundation of baby feeling safe in the world. And the attachment parenting idea is one that where baby's attached to mom literally all the time. And the idea is good, but I think even more important is that attunement, because if baby knows that mom is there for them, they don't have to be connected 24 hours a day for baby to feel safe and secure. So I like that language of attunement because I think it captures the idea of I'm tuned into baby. I'm watching for her cues to support her needs and her in a quick and kind way. I'm tuned into my baby.
Thank you so much for all that. And that's super helpful. And it's really good to clarify, the difference between attachment and attunement. Whereas it's important for the baby to feel that their needs are regularly being met and they regularly have that connection with their mom and their parents. But it might not necessarily be necessary to always be attached physically to the baby as long as you're paying attention as a mom to their cues and their signals and their needs. So yeah, that's helpful to know.
Yeah, and I think that some people think that if they keep baby attached to them, the baby will feel safe. But I think it's more important actually to develop that secure attachment that's going to go with them as they grow. So as babies become toddlers, they have big feelings. So for mom to be able to um, help baby navigate those new feelings as they are exploring the world and setting boundaries to help them understand relationships. It's going to really go a long way toward their relationship as baby continues to grow older, which I know you've got a toddler, so I know you understand that. But it's not just the physical closeness, but the actual attachment to, in terms of their relationship, their understanding of each other and the world. That's going to really help baby to feel secure and safe as they grow.
Right, absolutely. It's important to maybe clarify that potential misconception about what is and isn't necessary. Are there any other potential misconceptions about attachment and attunement that you want to clarify?
Well, I know you had one thing you had asked about was like how do you strike a balance, with keeping close to your baby, but also like being able to take care of yourself. And I think that's really the key. When baby knows that you are available in terms of to meet their needs in a quick and a kind way, like that, I always talk about things like safe sleep because babies aren't safe sleeping with parents in bed, and a lot of people feel like my baby will needs to feel me near them to feel safe, but that's actually not true. They need to know that you're there when they need you, and sometimes they're going to need you in the middle of the night just to hold them and help them to know that they're safe. But that still allows them to sleep in a safe place in their own bed, but with you close at hand to meet their needs. And in the same way, like babies need to sleep, and so you can set them up for meeting their needs, but also meeting your own needs, as long as you meet their needs when they wake up and they want to know you're there. Babies cry a lot in the beginning, and a lot of it is they just want to know that they're safe, and they want to know like how to as their brain is quickly growing that they are that you're there for them. So, but like I said, that whole idea of attunement, of understanding feelings and how the how to handle those feelings and how to move toward each other is a skill that if that child can learn is going to go with them into school as a sibling, as a friend, as a later on as a teenager and as a young adult. Like those opportunities to like check in, like take a deep breath, what am I feeling, how do I move toward this person with kindness instead of that, I feel triggered and I'm going to respond on a knee jerk reaction, pushing that person away or yelling or whatever. But an opportunity to like really attune and to build bridges instead of to build walls, I think is something that starts all the way back in infancy and goes forward in life. So I feel like it's such an awesome idea and really kind of a revelation for me, like a life changing thing to think about the fact that we can attune in our relationships with others. Like, what are they feeling? How can I move toward them with kindness? Um, yeah. So
Yeah, that's super helpful, and I can imagine that certainly your relationship with your parents starting in infancy would kind of set a child up for the path that they have in life later and the relationships that they have with others. I can also imagine that becoming more attuned to your child's needs as a mom or as a parent might help train even parents to become more attuned to themselves and their own needs as well. So it's a two-way kind of thing.
Absolutely. I think I love the idea that we're always building new networks in our brains, and we can. So even if this hasn't been something we've practiced in the past, we can grow and learn and continue to move like closer as, as a couple, as parents of, my children are now like young adults. So like how to attune to them and to how to stay connected with them is like almost more important now than it was when they were babies. But I love that even now we can continue to build those new networks in our brains. Like we can continue to grow and learn. And I have really learned a lot from some of the books written by Kurt Thompson in his podcast. So I definitely highly recommend that, looking him up.
Of course, yeah. And you said Kurt Thompson.
Mm-hmm.
Sweet. Yeah, I'd love to put his podcast in the show notes so that people can easily access that.
Yeah, The Soul of Desire was the book that was so impactful on me, but he has a podcast as well called Being Known.
Very cool. Good to know. Yeah, so I'll put that in the show notes. And I guess just one follow-up question. When you say being attuned to your baby's needs or always paying attention. I know a lot of first-time moms might feel a little bit overwhelmed by that concept. Like, what do they even look out for? Sometimes, I mean, obviously it's easy to tell when the baby's crying, right? But often they don't know like what it means, what it is they're communicating, especially in the very early days. So what are some specific things you recommend parents be attuned to in terms of how babies are communicating their needs?
That's a great question, Miriam. So we talk about feeding, like there's things like feeding cues. So like a baby, before they're actually screaming, they can give early feeding cues, things like licking their lips or like just stirring in bed, bringing their hands up toward their face. Like these are all early feeding cues. And if you can get baby before they have become like frantic and starving, it's going to be a little bit of an earlier way to attune to the fact that they're communicating, hey, I think I'm getting hungry. Or they may start, just squirming around because they're uncomfortable, want their diaper changed. Or even things like when a baby is looking at mom in the eyes and is smiling or is engaged, that's baby wanting to engage with mom. And if mom responds, baby's going to continue, but baby may get overwhelmed at some point and may turn their head away. And if they turn their head away, that's an opportunity to let baby like regroup, kind of like get themselves regulated again and then re-engage. But parents sometimes miss that and try to continue to engage baby when baby's overwhelmed. And that may lead to baby becoming more dysregulated and starting to cry because they were trying to so it's just being attuned to what baby's trying to communicate. And even from the very beginning, babies are expressive with what they, and if we start paying attention to those little cues, we can like understand what baby's communicating. And then as they get older, they'll communicate in other ways. And it's just really fun and exciting to be able to help parents understand that they can understand their newborn. They can learn about what their baby's communicating, and that their baby's going to want to communicate with them in lots of ways. So there's lots of opportunities as baby grows to teach baby sign language so they can communicate when they're hungry or when they're all done or when they want to, a drink or things like that. There's ways to communicate that you can help them to like decrease their frustration by teaching them to communicate and learning what their cues are. So it's a really great opportunity for providers to help parents understand that babies want to feel secure and safe. Primarily, that's like it's like a primal need that we need, is to feel safe and secure. And everybody has that. So it's from infancy all the way up, through adulthood. We always want to feel like a secure attachment to our, to our partner, to our parents, to our children. It's a very life-giving relationship bond.
Absolutely, absolutely. And I can imagine that. I mean, just speaking from my own personal experience, it is definitely a little bit of a learning curve. And it's a little bit like learning a new language, I would say, just learning how your infant communicates before they know how to talk or do much that, that use many of the tools that we use to communicate as grown-ups. It's definitely like, it's a little bit of a learning curve, but it's an important it's an important journey to have. It definitely pays off. Just pivoting a little bit, just because, we probably have a fair number of medical professionals listening. What do you feel that medical professionals can do to help promote a strong bond between new moms and their babies?
Well, I think one thing that we can do is talk to our moms about the fact that, and our parents in general, about the fact that their world is very big. They're distracted by a lot of things. Their life is busy. They've got work and relationships and phone and all of the technologies that we are, that are in our lives. But for a baby, mom and dad are their world. So it's their everything. So giving your attention to your baby and really like seeing them and paying attention to them when they're tiny. They may not even be interacting at all, but their brain is growing at just this light speed. Like, you would not believe how much brain growth happens in the first 1,000 days. 80% of baby's brain is formed between pregnancy and baby's second birthday. So their brain is continually making connections. So the more serve and return that they experience in that time of connecting with their mom and dad, like, in all the fun ways you can connect with them, even before they're responding back to you, is building those connections in their brain. And babies' skull bones aren't fused until they're 2 years old, because their brain is growing so rapidly that their skull has to expand for that growing brain. And so parents understanding the importance of really interacting with baby from, even during pregnancy, and then like right from the start, of reading to baby every day, of singing with baby, playing with baby. These things are so important. So for communicating that to moms, that this is the primary way that your baby learns about the world is through his relationship with you. So, like, just really focusing on that importance of attuning to baby, I think parents can really benefit from that message.
Absolutely. It's really important for medical professionals to take on a role of educator there, and just let parents know what's important in building their relationship with their babies. Are there any resources you would recommend, especially for parents who, obviously having a child is a major time commitment, and a lot of parents work and might feel a little bit overwhelmed at the concept of adding things like reading to their baby to their routine? Maybe some moms are feeling a little undersupported, or are there any resources you'd recommend, even just for educational purposes, if not programs like yours, the Nurse Family Partnership, where new moms can get actual physical support from a nurse? Any resources like that?
Well, definitely, I think looking to their pediatrician for support is one place, but also like things like libraries and community centers have programs where you can bring your baby to story hour. There's things like, of course, things like other programs like Kinder Music and lots of other, just programs you can do with that sort of foster your interaction with baby, and play with baby. But something as simple as reading a board book every day, like the same book every day, baby will recognize that. Even, if you read it to the baby while you're pregnant, like I know one mom who read Dr. Seuss to her baby every day while she was pregnant, and then afterwards. And it's opportunity for you. And those moments and those times are very precious, in terms of your child will love the books, and you'll treasure the time that you have. So make it a part of your routine, even if you're a working mom and you're only getting to be with baby morning and night. Like, make sure that you spend some time making a bedtime routine, and putting some rhythms in place that are familiar and help your baby, because babies are very uh, helped by routines and things like that, just rhythms that are the same. So doing the same thing every night before bed is going to help baby to settle down and be able to go to sleep. So that's one opportunity, but just all through the day, you can talk to your baby. This can be as simple as talking about the things you're seeing outside, the things you're hearing, the color of the rug, just anything. You can just continually talk to baby, because baby is making connections with things they're seeing and hearing. And so explaining the world to them is a simple way to do, without really any, it's not, doesn't need any extra anything. It can just be you and baby in whatever you're seeing or doing, just talking to baby. Now I'm going to make your milk. Now I'm going to feed the dog, and now we're going to wash the dishes. Like, you can do some sort of simple things, just narrating life to baby as she's sitting next to you on the, on her little bouncy seat. You could be talking to her and explaining what you're doing and what you're seeing. And I think that's really a simple way that parents can connect with baby and explain the world to baby, that are really helpful and don't require anything extra.
That makes sense. And it seems like some parents might overestimate the amount of extra, like going out of your way type effort that it might take. What's most important is incorporating the baby into your life, and just kind of adding them seamlessly into what you're already doing. So that's helpful as an insight. So yeah, Betsy, is there anything else you'd like to add on this topic before we close out?
Well, I just want to say, like, I think that that attunement is a message that we can use, like, in all our relationships. So as human beings, like, we're always connecting with people, and we have opportunity to move forward with kindness in the world. And I think, whether it's somebody at the grocery store or at the gas station, or, just people that you encounter anywhere, like, the opportunity to move forward with kindness and to move toward people it's like, I think it's what Jesus did, but it's like life-changing for us to be able to, get that idea that we can support and encourage each other, and connect with each other, attune to each other, even as adults. And so I think it's really, I think that's the thing that I really want people to take away, is, like, think about how you can, if you have a broken relationship with somebody, think about how you can move toward them. Try to think about your own feelings, but then think about how you could move toward, whether it be your baby or your child, your parent, whoever it is. Think about how you can move towards them and see what happens.
Absolutely. It's a philosophy you can take with you to other relationships, not just with your baby. Thank you so much, Betsy, for coming on and sharing your insights.
Oh, thank you, Miriam, for having me. And thank you for all the work that you're doing. I really appreciate you.
Oh, I appreciate it. And thank you so much to our listeners for joining us today. If you like this episode, be sure to give us a 5-star review on whatever podcast app you're using to listen. Or if you're watching on YouTube, give us a like, hit the subscribe button so you won't miss any of our future episodes. And with that, we will see you next week for our next episode.